If you know your business should be growing faster, listen up. Most business owners understand the fundamentals of what it takes to run a business. For instance, you need some new patients, they need to choose care, and then you treat them and they get better. Fundamentally, business owners in the medical space, in the chiropractic space, they understand those mechanics. We call it flow, conversion, and retention. Flow is your flow of new patients into your office. So say you put an ad out and you say, if you have back pain, we can help you. New patients flow in and they say they have back pain. So in your advertising, you promise something. If you have back pain, we can help you. And they arrive because they want help, because they have back pain. So that's your flow of new patients. So your marketing is promising something. If you have back pain, we can help you. There's a promise. A consumer looks at that and says, great, I am going to actually come into this office, flow into this, because they help people with back pain. Make sense? So now they arrive. Now there's conversion. Conversion is whatever process you have in your office that you examine and you work up your patient. You could do an examination, maybe you do a posture analysis, maybe you take some x-rays, whatever you do in your office to be able to examine the patient, and then you tell the patient what you can do for them, and then they believe that you can help with their problem. Remember, you marketed and said, if you have back pain, we can help. They arrived and said, I have back pain, can you help? You did an examination process and you said, you have back pain, we can help, and they exchange money for it. This is your conversion process. So conversion is, you have a problem, let me tell you what we can do. I believe you, and here's my money. That's conversion. So they believe that you can solve their problem. And then we move them to the next area of the practice or the business flow, to retention. This is where you retain them long enough to actually solve their problem. So it's a beautiful life cycle. If you have back pain, we can help you. They flow into the office and they say, I have back pain, can you help me? And you enlighten them, they exchange money, they believe you can help them, and then you retain them and you solve their back problem. And then that person then refers somebody else in, and you have this beautiful life cycle. But there's one question that we never ask. It's incredible, the question that is actually never asked, which is, why did they answer the ad to begin with? So you put an ad out and you said, if you have back pain, we can help you. All right, good. But let's do some math here. Say you're just dropping postcards. I'm just gonna make up you're dropping postcards, right? And you say to whatever company you're working with, hey, I want postcards dropped to this demographic, 40 to 75-year-olds. It's gonna be, if you have back pain, we can help you. And I want it to go to this income area. You get very exact in where it's going. Let's just say 50% of the population have back pain. I'm pretty confident it's more, but let's just settle on 50%. I think we can all go, okay, that's a number we can have. So you drop the 5,000 postcards to that demographic of 40 to 75-year-old in the income bracket that would have income to pay for your services, and you say, do you have back pain? I can help you. Well, mathematically, statistically, you should have 2,500 phone calls because you dropped 5,000 postcards, but you don't. You get 20 people who respond. And the marketing company tells you, they give you these numbers, hey, we're gonna drop 5,000 to this demographic, you're gonna get 20, you're gonna pay this money, and you're gonna get ROI on your investment, and all of this stuff they tell you, and you go, well, that sounds really good. I know for sure that Mike and I, over the many years, we were approached by different companies to do different things. How about in the grocery cart, you know those pictures on the grocery cart? 10,000 people are gonna see that, and if you have back pain, they're gonna answer the ad, and you're gonna get 3 people a week to see it, and 5,000 a week are gonna see it. Do you see all of this? We've all have this. This is what the marketers tell us. And we buy into that you send this thing out if you have back pain, and only 20 will answer. But mathematically, it doesn't work. This doesn't even make sense. If 2,500 people of those 5,000 have back pain, why didn't they answer the ad? It's the question we never ask. Looking forward to seeing you. Click the link up, down, or wherever the button is.